Live from Griffin Hospital, I'm Kate Chaplensky with the HAN Network. Griffin Hospital's been nice enough to have us here with our mobile studio today. And right now, I'm joined by Dr. Lionel Lim, who is the director of Griffin Hospital Geriatric Assessment Center, and Maria Tomasetti, who is the South Central Regional Director of the Alzheimer's Association Connecticut chapter. So happy to have you both. Dr. Lim, first I want to ask about the Geriatric Assessment Center and the work you guys do there.
Well, we have a geriatric assessment center where I see patients myself together with a nurse practitioner, and we get referrals from the community, including community physicians, when they are dealing with patients with age-related health issues such as cognitive impairment, dementia, frailty, falls, trouble managing their cares at home. And so we see a lot of these patients where we can help and assist them and manage some of the chronic health problems.
And Maria, tell us a little bit about the Alzheimer's Association Connecticut chapter right here.
So we're a nonprofit organization. We provide programs and services for families with loved ones with any type of dementia, including Alzheimer's disease. We have a 24/7 helpline, which is not just an emergency helpline, it's any question regarding dementia helpline. We have a statewide network of support groups. We provide community education programs, in particular family, caregiver education programs, care consultations, and all of our services for families are free of charge.
And now Maria and Dr. Lim, you both are teaming up both of your organizations are teaming up for this Caregiver series. Can you talk a little bit about that and what that is about?
Sure. It's a series that's been organized by the Alzheimer's Association Connecticut chapter, and there is a support group that meets at Griffin Hospital every month. And I was asked to start off with a talk about how to manage patients who suffer from dementia and Alzheimer's disease in particular, especially for family members who are struggling to care for them at home. So I'm privileged and I'm thankful for the opportunity to lead in the series of talks, and I'm excited to do so.
And Maria, can you just talk a little bit about dementia, Alzheimer's? It's so emotional for the family, and it's really it could be a very painful process. And so can you talk a little bit about the importance of this kind of program?
A lot of families think that they're alone, and this kind of a program can help them to see that they're not and help them to give them the tools. For example, as Dr. Lim mentioned, the first program in September is an overview of dementia, including Alzheimer's disease. The second program is communication techniques, behavioral challenges, strategies that can work and make it easier for families. The third week is community resources, keeping the caregiver healthy, which is so important, and caregivers don't think about it, as well as family dynamics. And then an elder law attorney the following month, which is actually it's 1 week per month, following month, which really can help families just have the tools to make their journey a little bit easier with their loved ones.
And now, Dr. Lim, the one thing you always hear about is finding a cure. It's such it can be a very scary disease. Are we any closer? Have we made strides?
There's a lot of research being done right now as I speak. Unfortunately, it is a very devastating disease. In fact, it's number 6 in terms of cause of death in the States. And unfortunately, there is yet to be a cure or preventive treatment for it. But there are things that we can still do to help with the symptoms of the disease and to help patients and families cope as they try to live out their lives living at home. It is, unfortunately, it's not diagnosed often enough, and the statistics would show that less than half of patients suffering from dementia or Alzheimer's are even aware of their diagnosis, which is really unfortunate. So I think there needs to be definitely more education out there amongst patients, families, and clinicians about the importance of making that diagnosis so that we can initiate management strategies for them.
And Dr. Lim, how could people find out more information about the services offered here at Griffin?
They can go to the Griffin website and they can find out more about the Geriatric Assessment Center and the types of services that we provided for our elder patients.
And Maria, we want to talk more about this. This Caregiver series starts September 8th. How can people sign up or get involved? How can they get more information?
So they can, certainly call Griffin Hospital is the number that's been advertised, or they can call our helpline also, 1-800-272-3900, or check our website, www.alz.org/ct.
And what are some of the other information that's available on that site?
It's a variety of caregiver information, information on our programs and services, just information that will help caregivers realize that they're not alone. Also information on our Medical Alert Safe Return program, which is an identification and emergency response program, since 6 out of 10 people with a dementia will wander at some point.
All right, well, Dr. Lim, Maria, thank you so much. This is such an important topic. So happy you could join us here at Griffin Hospital to talk more about it.